Hi, everybody. Yes, it's me, Dr. Yentl Gamiet, Pediatric Surgeon in East London in private practice. And today I have the privilege of interviewing Dr. Busi Skosana, who has just joined us here in East London. We're very privileged at Pathcare as a microbiologist. So, welcome, Busi. Busi's full name is Lebogang Busi Skosana, and she hails from Pretoria. So, we have very exotic people here now. Undergrad at UCT, postgrad at University of Pretoria, and she worked at the NHLS until May this year, and she's been in East London since June. So welcome, Busi.
Thank
Would you
you.
like to tell us anything about yourself that we haven't covered? We have so much more than our qualifications. So
Yeah, no, definitely. Gosh, I literally got here in June this year, so about 3 months ago-ish, from Pretoria. So I'm absolutely loving East London. And yes, I studied in Pretoria, grew up in Pretoria. So it's very exciting being here, having a new experience in a new province. Yeah.
awesome. Well, we're very, very glad to have you, and we hope you have really experienced the hospitality that the Eastern Cape is known for. And I'm glad you like East London. It would have been awkward if you didn't. So what interested you in microbiology in particular?
So I was always fascinated by these organisms that we can't see them, but they're there and they have such a big part to play in our daily lives and also in disease. Because in medical school, I mean, all we're ever taught is what can go wrong, what's the disease and how do we treat it.
Yeah.
So when we got to the block where they're teaching us about the microorganisms, I found it really fascinating. And I just wanted to know more and learn more. And I wanted to work in a laboratory setting, but also have that contact with, the clinical side of things, which is where we still have the discussions with our the other doctors. Like you would have your patient and would discuss, have advice. We still walk through the hospitals, do ward rounds, but I've also got my laboratory side of things, which I think makes medicine a bit more interesting than just, working with the patients. Yeah.
Awesome. Yeah, no, a lab, I think it sounds really, really, really cool. And
Yeah.
what are some of your favorite aspects of microbiology? Well, actually, let's go back to the beginning. What is
Mm.
microbiology?
Microbiology is the study of all the teeny tiny organisms which exist in our world. So we look at bacteria, viruses, fungi, which are yeasts and molds, and of course parasites, so worms and all of that. And it's micro because they're really tiny. You can't see them with the naked eye, but we have to use microscopes to be able to see the organisms, visualize them. And usually, how we're able to access these microorganisms or see them grow in the lab is through a specimen from a patient. So, let's say you're feeling ill, you go to the doctor, they'll ask you to maybe give the doctor some poo or urine, maybe sometimes blood, and then you send that to us in the lab, and we're able to make those organisms grow. And we can tell the doctor, oh, this is the bacteria that's causing the problem, and this is what you can use to treat it.
Amazing, really cool. Must feel so powerful to be able to make things
Yeah.
work. And then just as a segue, what like stool, be me being Dr. Good Poo and this being
Yeah.
part of the run up to the Good Poo Festival, what
Yeah.
what diseases or what can you pick up from a stool specimen?
Okay. So most of the time when the doctors send us stool or poo, it's when the patient has a runny tummy. So you've got some kind of diarrhea going on. It's been going on for a long time, and you really want to find out what is the organism that's causing this problem. And other times it's because the diarrhea is a bit scary. Maybe there's some blood in it, or there's some mucus in it, or you've seen a worm. And then you'll go to the hospital, the doctor, and then they'll send us that stool. So most of the time, the illnesses would be gastroenteritis, which is an infection causing diarrhea, causing stools to just run and run and run. And yeah, your doctor would then send your stool through to us, and we would look under the microscope, so microscopy, Then we would do culture, which means we make it grow. If any bugs which are inside your poo, we're going to help them to grow in the lab. And then susceptibility testing, basically, we're looking to see which of the antibiotics will work best in order to treat you from that stool specimen.
Okay. And tell me, why is it important to do susceptibility? So why can't we just treat them all kind of the same?
Yeah, that's a great question. And the reason is when you've got a certain type of bacteria or whatever organism it is, we'll focus on bacteria because we have a lot of bacteria within our poo, in our gut. You need to know what's the name of that bacteria and what type of antibiotics will actually work to treat the bacteria. Because we have different types of antibiotics available out there, right? And they have different names, different ways of working. They have different mechanisms in the way that they kill the bacteria, which are causing the problems. So, for me to be able to advise your doctor and say, rather use this antibiotic instead of this one, I need to know which one of those antibiotics the bacteria are susceptible to. So, there's this term called antimicrobial resistance or bacterial resistance. You might have also heard of superbugs. So this is a big problem globally throughout the world. We've got a lot of bacteria which have learned to be resistant to being treated by certain antibiotics. And that's simply because we've been using them too much. We've been using them incorrectly. We use them when we should not be using antibiotics. So, back to your question, why do we need to know the susceptibility? It's so that you treat the correct organism for the correct patient at the right time. And that is what we refer to as antimicrobial stewardship. So, being a good steward of the antibiotics or antimicrobials. I should
Amazing.
probably say the difference.
Yeah.
So, antimicrobial, basically, it's an umbrella term. So, it's antibiotics, antivirals, antiparasitic agents, antifungals. So, any of those medications that we use to treat the microorganisms, it's
Okay.
antimicrobials.
Amazing. So when your doctor says that they think this is a viral organism and that it will probably pass and they don't want to prescribe antibiotics, they are just being very good stewards of antibiotics or antimicrobials. I think that is very important for our parents to know and to
Yeah,
understand where that sentiment or that move comes from. But
yeah.
Busi, not all bacteria and viruses and fungi are bad. Can you
Mm.
tell us a little bit about your insights into the microbiome and how we can develop or how we can strengthen our microbiome?
Yeah. So, microbiome, basically, all of us have a whole lot of microorganisms which form a part of who we are, right? We call them normal flora. These are normal bacteria, they are viruses, they're yeasts. For this talk, we'll just focus on bacteria and we'll focus on the gastrointestinal system. So, that's your gut. That is where, your food goes. It's how where we create the poo, and that is where we find the highest number of microorganisms which live as commensals. They are normal flora. They form part of the microbiome. So within all of us, we've got our so-called good bacteria, and then we've got those that can cause disease, and those we're going to call the pathogenic bacteria. So the great thing about the normal flora, or all those that make part of your microbiome, is that they help to protect us. They actually help by holding onto the sites or the parts of your gut on the inside so that the pathogenic bacteria have nowhere to grab a hold on. They have nowhere to attach because the commensals are there. And then they also help by regulating the immune system. So having a good gut microbiome or good gut microbiota is really important in helping you to fight illness, in helping you to remain healthy. And then later studies have also shown that there's a very important part in physiological homeostatic functions, which is played by the microbiome. So you can think of those bacteria which are actually there in your gut. They actually play a role in making sure that your normal functions are able to continue. Yeah, I think that answers your question.
It does. That is so interesting that it actually, there's so many different components of the body functioning well. And I think
Mm,
as doctors, we've really underestimated the microbiome and we are catching on to it, where I think many other practitioners have known for a long time. And what a
yeah.
big role diet plays in
Oh,
feeding
yes.
the microbiome, and keeping it
Yeah.
healthy. I feel like
Yeah.
you're the real Dr. Good Poo. I'm gonna have to make you a hat, cap, but we
Anyway.
both could be Dr. Good Poo.
Oh,
So I
yes.
think, thank you so much for that. It's been amazing to hear your insights from the lab because my perspective is clinical, like working in consulting
Yeah.
rooms and in theatre. And all of us doctors, we all have a different place that one angle that we approach disease from and health from. And so it's so great to have teams and to have friends that you
Yes.
can call and bounce things off. And I'm very thankful that your number is saved on my on my phone and that I can call if I have
Yeah.
any question. And Dr. Busi is from, or Dr. Skosana is from Pathcare, and Pathcare is one of our partners in the Good Poo Festival. Um, this is just kind of a blurb and a run up to the festival, which happens on the 18th of October. And it's mostly an immersive theatre production. We're showing it twice, so once early in the morning and once a little bit later in the morning. And it's a story about the microbiome and constipation, and what children can do and what families can do to make sure that everything functions well. So thank you so much for joining us and for chatting to me. And I'm looking forward to um, bouncing a
Good
lot of
food.
ideas. Yes, to good food. Thanks so much, Busi. Take care.
Thanks for having me. This has been fun.